Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. Today's going to be a fun episode. We're going to talk about HIPAA Compliance and how it relates to COVID in your office. I have a true expert with us, not someone who's guessing, but someone who is actually an attorney practicing law who specializes in HIPAA compliance within medical and dental offices. Say hello, Olivia Wann.
Hi, and thank you, Patrick, for having me back on your show.
Yeah, we're grateful to have you here. I think our audience is going to be really grateful to hear some of the things that you have to say today and clearing some things up. So for those that don't know you, tell us a little bit about your background. How did you kind of start working in HIPAA in dental practices and medical practices?
Well, my early background, I worked for a general dentist for 14 years as an office manager and a dental assistant. And then when I left private practice, I started consulting and training. I have a bachelor's of science in healthcare administration as well as a doctorate in law. And so I just morphed into a different level of serving the dental community. And so I've been consulting professionally 21 years already. So I've been around the block a pretty long time, and I've enjoyed working in this capacity.
Yeah, so that's amazing, the background. The level of experience from working in a practice to law school to being a practicing attorney specializing in this. So let me get right to the point of why I want to have you here today. I'm hearing a lot and seeing a lot of conversations where dentists are asking and physicians are asking, hey, how do we handle patients when they ask, hey, has everyone in here been vaccinated? Have they received a COVID vaccine or the second one? Specifically, one thing that I'm hearing quite often is people saying that it's a HIPAA violation to disclose that information to patients. Now, I would assume, being a layman, that if the patient received the medical care there, that it would certainly be a HIPAA violation if you didn't have permission from the patients. But unravel this for us. Kind of tell me what is and what isn't a HIPAA violation when we're talking about vaccines for teammates.
Well, we could drill down and determine, is the employee a patient in that practice that would trigger federal HIPAA to apply. But if we reason on it, vaccine status is medical information, and that information should be protected. Now, what I'm suggesting, because we are still in the emergency authorization use of the vaccines, and it is so new that we have very limited information until something is litigated. And so what I'm encouraging practices to consider is that, one, we need to respect the fact that the vaccine status is medical information and people have the right to place restrictions on how that information is shared. But when a patient calls the office, I think there needs to be some rehearsed dialogue at the front lines to, one, assure the patient that the practice is in compliance with all of the latest guidance for infection control as it pertains to COVID-19. And so they may want to write that down on an index card or something comparable to that language, because people are looking for reassurance. And then another discussion to have would be, if you are working in a dental practice and a patient calls and asks, is my hygienist vaccinated? If you're getting that question a lot, then I would consider having a meeting with your team members and asking if any of them if they're willing to disclose that information. So you can simply type up something very simple so that, Jane Doe, dental hygienist, I'm willing to share the fact that I have had the COVID-19 vaccination. You can share that information.
Sure.
Now, some people may not want it shared. Now, that's the same reason, Patrick, why I'm suggesting that dental practices and medical practices consider whether their vaccine, the COVID-19 vaccine program, is mandatory or voluntary, because that could be a big difference on how that's treated internally as well as with the government.
Right. So you're saying are you saying within the practice? Or are you talking about CDC guidelines?
No. So what I'm talking about is, right now we're in the emergency use authorization. And so some of the practices, and I've read on Facebook that some of them want to have mandatory COVID-19 vaccine. So what they don't realize is that if someone declines the vaccine, it could subject them to a dismissal. So are they ready for that?
Right.
Another factor to consider is that the allowance for certain exemptions, and those two exemptions would include an accommodation because the person has a sincerely held religious belief, and that would be the reason that they're declining the vaccine. Or it could be that they have a medical compromise that contraindicates having the COVID-19 vaccine. So whether you have a voluntary program or a mandatory program, most people are going to consider those exemptions. But with a mandatory program, even with those exemptions, someone could be subject to dismissal. And we feel that this is going to open up the door for a complaint with the Department of Labor, EEOC, maybe complaints using the Americans with Disability Act for discrimination. So let me set the stage, Patrick. So let's say the dentist is very pro mandatory program because patients are asking about it.
Right.
And so if dental hygienist 1 declines the vaccine, and this is a very hardworking hygienist,
mm-hmm.
and they acknowledge the declination. The next person declines, and they're not hardworking. They're always calling in late or this or that. And that person ends up dismissed on the grounds of the vaccine. Well, see, it could result in a complaint because somebody's could say, well, I was terminated and the other one was not for the same reason.
Right.
Or they might use other reasons thinking that they were terminated. Well, I was over 40 years old, or I'm a minority, or whatever reason that they might use for grounds of that termination. So what we're encouraging dentists and practice owners to do is to consider a voluntary program and find out what are the reasons for them to decline, because each of the vaccines, and we have 3 that are FDA approved, they all have fact sheets online. So take this as an opportunity to educate people for those that are not getting vaccinated. Now, if everybody in your office is vaccinated, well, then that's an easy thing to respond to. But the problem may be sensitive if the person is scheduled with a hygienist or a team member that declined the vaccine.
So that makes a lot of sense to me. I get it. I think I understand it. I still have a little confusions on HIPAA, which I'm going to come back to just in a moment. Let's talk about patient's perspective a little bit. So not the legality so much, but obviously you have a ton of experience in here. I personally think patients are asking. I think very few patients are asking because they're concerned. They want to make sure that they're reducing their chances of getting COVID by seeing healthcare offices where everyone's vaccinated. I don't think that's the reason why most people are asking. I think most people are asking because there's still a large percentage of the population, 80%, who hasn't been vaccinated. And I think they're trying to decide for themselves whether they want to or not. And who would you ask this type of thing? Usually people that you respect and that you trust. So I don't think it's an odd thing. And I know some of the responses tell the patient it's none of their business. That to me kind of seems like, hey, I'm trying to get some healthcare information here to decide if I'm going to get the vaccine. You're telling me it's none of my business. And I think also if you answer that way, with an indirect answer, we follow CDC guidelines, which I think could actually be arguable if you're not vaccinating, if all your team is. And I don't think that you are actually following those guidelines. But, you can kind of see how this would all of a sudden look very fishy to a patient when they're asking this question. So how would you answer that? What's the best way to answer that question if your team isn't vaccinated?
I think I would tread carefully. There are other vaccines that are declined in healthcare. There are individuals in the healthcare world, including dentistry, that have declined hepatitis B vaccines and other vaccines as a result of their religious practice.
Sure.
And, patients are not calling up and asking, what's the status to the dentist hepatitis B vaccine? So I think we need to handle this very gently. And that's why the dialogue should be prepared and rehearsed. For example, we could address with the patient that the level of personal protective equipment that's being utilized, yes, that protects the worker, but think about the barrier that's being made with these shields and mask or respirator, the barrier that's being made between the healthcare worker and the patient. Also, look at HEPA filtration. So many dentists that I've talked to have implemented engineering controls such as HEPA filtration, external evacuation units, as well as other devices to control the aerosols in the room.
Sure.
And so these are things that should be discussed. And I mentioned this to a seminar group last week at Henman Dental Society that, rather than talking about, oh, it's a beautiful day today, the sun is shining, maybe we should bring up these engineering controls that we've implemented and bring it up. Like, for example, we just implemented this HEPA filtration. We're doing these things for your safety while you visit our dental practice, as well as the safety and health of our workers. So talk about it and do so in an educated way. Maybe you can even rehearse the dialogue among your team members. But I think that it's a good idea to review the latest CDC guidance because it does change periodically. And we are awaiting a new OSHA standard on infectious disease. And so that will address COVID-19 specifically, because right now we don't have a standard other than recognizing it as an aerosol hazard and complying with the respiratory protection standard.
Sure.
And so
Again, I'm not, obviously, you're the expert here. I'm not at all, but it doesn't mean that I don't from time to time argue like I am an expert, right?
Sure.
I'm human like the rest of us. I know that a major national hospital system in this country, I'm just not going to mention their name, but people can probably guess, it's pediatric hospital. And during flu season, when you go into their buildings and their facilities, they don't require all of their employees to receive the flu vaccine. However, if you don't receive a flu vaccine, you're wearing N95 and you're not wearing the little badge that says, I've been vaccinated for the flu, you should too, or whatever. So it's pretty clear for people quickly to find out who's not been vaccinated. And by the way, there's very few people that you see, again, this is anecdotally, that you see walking around the building that have masks on during flu season. So how are they doing that without violating people's HIPAA privacy?
So hospitals, long-term care facilities, nursing homes, when they have a mandatory flu vaccine policy and someone declines it for a bona fide reason, then they are required to wear a mask during flu season at all times, except while they're eating their lunch or drinking a beverage. So the way it is right now, that's the case already. And so according to CDC, if the clinical team member is working with a patient, they have on PPE. And when they're not working with a patient, they are to wear a face mask or a cloth face covering if they're doing administrative work or they're in a different admin area of the building. So as it stands right now, they would be, so to speak, suited up. They would have on their PPE, whatever that equates to be. And so until we're told otherwise, they should never be without a mask in the dental office.
So, and an at-will employment state, like we're in Colorado. I believe you're in Tennessee, correct? Mm-hmm. That's where your office is, but I know that you work nationally. At-will state certainly if an employer thinks that you should be vaccinated and you don't want to, they can find any reason to terminate you in short, correct? I mean,
So at-will employment means that you can be terminated for a good reason, a bad reason, or no reason at all, providing it does not violate your rights. And so if someone is dismissed because of a religious belief, then that's getting into troubled waters, or
Sure.
they have a medical compromise. And what I've read in the journals and the discussion groups, that even with those exemptions, someone could be dismissed if it's an undue burden on the employer. Now, I cannot imagine someone dismissing an employee on those grounds. Now, with that said, there is a need for education. When we read why people are declining the vaccine, some of them are saying that they're not necessarily declining the vaccine permanently. They're just wanting to wait and see how things go.
Right.
Because it is in the emergency use period.
Sure.
Some of them are concerned that they would have side effects. And one of the things I mentioned to my seminar group is, there are people that have side effects, and yes, there could be death that results from a vaccine, but how many deaths are resulting from COVID?
Right.
Just like with the flu vaccine, some people will say, oh, I don't want the flu vaccine. How many people die annually because of flu? Something that could be prevented. And so it looks like, based on the responses of those declining, that it does shift the responsibility back over to the owner and management to better educate people to accept the vaccine. Now, I don't want this to sound like a bribe, but I have read some literature where people are being encouraged to give people the day off with pay.
Yeah.
So think about it. If they had their vaccine at 8 o'clock in the morning and they had the rest of the day off in case they did have some mild symptoms, or they might feel great like I did, and they could have the day off to do whatever they want.
Right.
And so we're looking at some incentives to provide to get them to overcome declining the vaccine.
Sure. So what about, when does the rights of and this may be, we may have to do another episode for this, but when do the rights of the doctor, and for example, the doctor believes, hey, I think it is in the best interest of our patient that only team members who are vaccinated come in any type of physical contact with this patient, and they believe that is the standard of care that they need to uphold in their practice. And somebody's religious beliefs say, oh, and by the way, I'm not yet familiar with an anti-vaccine religion, but I'm sure that there's one out there. Where their beliefs, so their religious beliefs or convictions say, no, I'm not going to get the vaccine. What happens when those two things collide?
Well, that's why there's an allowance for the employer to dismiss an employee even with those exemptions.
Got it.
However, what I've seen, and you could take this for what it's worth, if I have the dentist declining the vaccine, then no one is getting it because they have the attitude, well, my boss is not getting the vaccine, then I don't want it either.
Right.
Where the whole group is declining.
Sure.
But most often we find it's one or two that have declined and they're just waiting to see.
Right.
And so once again, I think we just need to try to overcome those objections. And the way we've handled it with our clients is we have created some voluntary COVID-19 vaccines. And we have a checkbox showing that they accepted, a checkbox that they've declined it, and a checkbox that indicates I would like more information, so that we can gather details of what we need to do to encourage vaccination. And I've even included some verbiage that at any time that the practice decides to make this a mandatory program, that the employees would be notified in writing.
Yeah. So I think that's great. I think this is brilliant. I think right now, all of a sudden, it's amazing how many team members, or the level of conversation that's going on around HIPAA compliance and practices. I've never seen so much debate about it. I've never seen the 5 letters used so many times in the last month, and it's all over. Isn't it a HIPAA violation for my employer to say if I've been vaccinated or not been vaccinated? Let's talk about real quickly. Let's talk about common HIPAA violations that happen all the time that we're not talking about, that aren't really so sexy right now, as the COVID vaccine HIPAA compliance issue or non-issue. What are some real common HIPAA compliance issues that are real and significant?
Well, I mean, we literally could spend days on this, and I think it depends on, are you talking about privacy violations or security violations? And that's why we feel as an organization it's so important to continue providing training on the privacy rule, because we do see gross violations. Let me give you a recent one.
Yep.
We worked with a practice that has a window on the side of the building that looks into the building. So if you're on the sidewalk walking down the street, you can look into that window, and there were paper charts. Now, rarely do we see paper charts anymore. And if we do, they're a duplicate of what's already in the computer system on their management programs. But it was a very obvious violation that the charts had their names visible, phone numbers, and medical alerts. Had we not gone on site, we would have missed that, obviously, when we are assessing the level of compliance. And then when it comes to, and we see that, what do you see at the front desk? But when it comes to security violations, I have concern that they're not following NIST for even their cyber best practices on encryption, having the right policies in place, particularly with the safe harbor that was signed into law first of the year. It's going to involve making sure that they're practicing those best cyber practices. And if they're not going to be able to seek relief from this new law that I bet you're talking a lot about too.
Yeah, absolutely. On the one last question that's about the HIPAA again and COVID, wouldn't be saying that, hey, the hygienist is out today, she's got a stomach bug or a family sick. Wouldn't that also be considered giving out protected healthcare information just the same way that saying they've been vaccinated or non-vaccinated is?
I think that there's a level of privacy that should be expected. If someone is out for the day, there's no reason to tell patients why they're out.
Sure. Whether
that person is closing on a new car or they have stomach flu, there's no reason to share that information. And so, whether we're looking at it in terms of a HIPAA violation or not, the fact is, getting back to the COVID vaccines, if this is how it could be argued, if most employees go to the dentist they work for, they're a patient there, correct? So so 9 times out of 10, they're a patient there, sure, even if they just get cleanings, if it's a pediatric office.
Yep.
And so if they're a patient there and that information is disclosed without authorization, it's a privacy breach.
Sure.
Now, what's going to be the extent of that? Remember, HIPAA does not give patients a private cause of action, meaning, okay, somebody talked about your vaccine. How much do they have to pay to make it right? Well,
right.
The patient doesn't have a private cause of action. If there's no damages, they have no action on a civil level. But when there's a privacy disclosure, that could subject the practice to a complaint. And so I think that bringing the practice to the most professional level possible would be to rehearse some dialogue that would be appropriate to give. I've even encouraged, because everyone is so suited up and beyond recognition, to maybe consider having your picture made without your mask, just like you normally look, and have it in a button, like you could make a button pin with your smiling face. And for those that are willing to share that they've been vaccinated, you could even include that on the pin.
Right.
And I bet you if there's people that are participating in this, it will encourage the ones that have declined or put it off. They too want that attention.
Right. I keep saying one last question. As you know, we keep this short, but when I have someone like you here, I'm going to take advantage of it and make sure that our audience gets as much as we can, as much as they can from it. in a non-healthcare related business. And a lot of our listeners support the community or, are in and out of practices, but are not a practice themselves. What can they do in as far as, they want to get back into work, they want to get back into the office they're paying all this rent for, they want to get the camaraderie going, the energy going, what have you. They want to bring their team back in as quickly as possible, but they really need vaccines in order to do this sooner rather than later. Can they require employees to get vaccinated? Or again, is it the same thing? I mean, they could be in an at-will state. They could be terminated for that reason or any reason for that matter.
Yeah, I mean, it's the same. The only disadvantage is, just like with my law practice and my consulting practice, we have about 9 employees. And so, it's not like we're serving patients clinically, but there's still a risk if someone's not wearing a mask.
Yeah.
Now, as far as the guidance is concerned from CDC, we're still told to wear a mask even if we're vaccinated. So until further information, we are told to wear a mask and practice physical distancing. But if you look at the material that's being published for private families and private gatherings, that if the family members have been vaccinated, for an example, there's no need to wear a mask in private gathering.
Right.
So that makes sense. And I think that's going to encourage people to be vaccinated. And the more people that are vaccinated and they see that they didn't grow another arm or another leg or they didn't die, it will encourage people that, look, I need to get it done.
Yeah.
And I do like seeing that on Facebook, on the different dental groups, that they will say, hey, I was vaccinated, because it encourages people. But Patrick, where I see a problem is they'll take a picture of their vaccine card and it has their date of birth. So that's identifiable information that could result in someone stealing your identity because they know your name and they know your birth date, and they could start mining more information to, create a security issue.
Yeah.
Stealing your identity.
Let me, what is the best website for our listeners who want to learn more about your services and HIPAA compliance and making sure that their practice is up to the standard that's required?
Well, the easiest way to do it is just go to oliviawann.com. And when you land on that first page, if you choose my legal services, you can go to the law website. And if you choose consulting services such as HIPAA compliance, then it'll take you to the dental site. And there's quite a bit of information there, including blogs that we're happy to share with you.
Sure. I might be wrong about this, but my guess is you're better off to go check out the compliance services and the consulting services first. That's probably a way to avoid having to click on that legal services.
Right. Yeah, that's so true, Patrick.
And I know you help practices with all sorts of legal services, not just bailing them out if they get.
It's so much, we compare it to a pro fee. It's so much easier to manage things prophylactically as a preventive measure. So we would really prefer to work with dentists before there's a violation and teach them how to avoid that problem than having to spend thousands of dollars on regulatory defense.
Yeah. Thank you so much for coming on today. I appreciate it. OliviaWann.com. Olivia, thank you again. I really appreciate you.
Thank you, Patrick.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.